Mayor de Blasio has unveiled his $82 billion budget for the city, and part of it focuses on the city's failing hospital system. CBS 2's Dick Brennan here now with more. Dick.
Well, Maurice, the mayor says the city's economy is doing well, but a large part of his address and the press conference afterward focused on the disastrous state of the city's health and hospital system, and he says it's time to encourage better primary care over costly hospitalization.
The system's facing a projected operating gap of $1.8 billion by 2020.
The mayor says the city's public hospitals are on life support and they'll be restructuring, cuts, and an infusion of money to keep them going. The mayor in part blaming federal and state cuts and, ironically, a progressive's dream, the Affordable Care Act.
Construction of the Affordable Care Act, there's not a clear space for the reality of uninsured people. And what we have now in this city is almost 500,000 people who are still not covered by any form of insurance and who qualify.
And then further stressing a system already in trouble. The mayor says the city also got a lesson from the blizzard of 2016. Big plows don't always work well on small streets. And so, one solution, get smaller equipment.
We're investing $21 million in equipment that's going to allow us to have a much more energetic approach in some of the streets that had some of the toughest problems in the last storm.
There are other plans. The mayor says he will target $170 million for an alternative facility for younger inmates of Rikers Island. And in response to the complaints of the residents of the 105th Precinct in Southeast Queens, one of the biggest and most spread out in the city,
we'll be investing $70 million to build a new police precinct in Southeast Queens, and that will benefit the neighborhoods of Laurelton, Rosedale, Brookville, and Springfield Gardens.
The mayor reiterated a constant complaint that the city is not getting its fair share of state dollars.
We're now seeing a proliferation, if you will, of the state government looking for more and more places to cut back resources for New York City and to offload obligations on to New York City.
As for the hospitals, the mayor says none of them will close, but they will have additional uses, like for mental health care patients. He says there will be no layoffs, but cuts through attrition. The city council must approve the plan by June 30th. Christine.
All right, Dick, thank you.